whole grain carbohydrates, good carbohydrates in your diet. Next is juicing is superior to eating whole fruits. Of course, it is time saving. You are not chewing, you are not cutting the fruits. You're just gulping one glass of fluid and leaving for your work. But it is not superior health wise. It may save you time, but health wise, it is not, because the fiber part, as I told you, your juicer is doing the breakdown. So, no points in that. So always have whole fruit or cut fruits, but not in a smoothie form or a juice form. Next is avoid fat to stay fit. Like fat are enemy, fat are bad, like this kind of thing. As I told you, avoid trans fat. Go low on saturated fat. But unsaturated fat like polyunsaturated fatty acid or monounsaturated fatty acid, FUFA and MUFA. These are very good, but definitely uh, moderation is the key. So you need to know how much to consume. Next is margarine always beats butter. It's not like that. If you are having probiotic butter or first of all, these are all under fat zone, falls under the fat part. So ghee is better, I would say. Butter, margarine, whatever you are having, try to balance your diet in such a way that the fat is taken care then. So margarine is really not better. If you are having a probiotic butter, then obviously that is much good. Next is eating at night causes weight gain. If your work schedule is such that you are coming back at 9 p.m., you are having dinner at 10 p.m., then you cannot do anything. But post meal walks you can do so that you are burning the calories which you are eating. So eating at night won't make you gain weight in that way. Yes, if you eat food and then lie down, definitely it will store. So what I suggest, eat food, then go on post meal walks. Then it will help to burn your calories. Next is red meat is universally bad for you. Like it is bad for everyone. It is not the case because often during the pregnancy case, especially, we suggest the lady to have red meat if required. So you need to know whether mutton or organ meat or red meat is actually you need them or not. It is not universally bad. Next, supplements can completely replace whole foods. No, 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 it cannot replace. If it has been like that, then you would have eaten supplements in a plate. Like it would not give you a mental peace. For example, in a plate, I'm giving you a red supplement, a green supplement, a pink supplement. Are you happy after having that? No. First of all, it would not help you mentally. The mental satiety level also matters a lot. And you are given a plate full of chapati, yellow dal, pink raita, that thing you would always love to eat. And also, supplements are just a support system. If there is too much of deficiency, if there is too much of lack in your diet, then only supplementation is required under the guidance of a medical practitioner. Otherwise, not over the counter buying and consumption of supplements are really not appreciated. Next is salads are the healthiest option. I've often seen people thriving on green tea and salads whole day to reduce weight. It is not correct. Why? Because you are not including proteins in your diet. You are not including carbohydrates in your diet, fats in your diet. Of course, from salads, you are getting vitamins, minerals, fiber, and water. The other groups are there, but the remaining part is not there. So salads are not really the healthiest option. There is nothing called healthiest option. Everything is healthy. So that is why you need everything in your diet plate. Next is detox diets flush out toxins. Now there is a trend of detox water or detox diet advice, something like that. So what is this term detox? Detox means D as in minus, removal. And tox means toxic, toxin. So removal of toxin from your diet through any diet is called detox diets. So you can give this a fancy term, detox diet, detox water, but whatever you are having in like your daily diet, you are actually doing the stuff only. So you do not have to buy those fancy tea bags like detox tea or detox water sachet, which are available online, I know. So because if your diet is a wholesome, a balanced thing, then of course your body is already doing the filtration part, already removing the toxin part. You do not have to work on it separately. Next is starvation diets are effective for long-term weight loss or intermittent fasting. Like many people come up to me and they only suggest, ma'am, give me intermittent fasting diet advice, as if they know that this diet is for them and following this they can achieve that. No, one size doesn't fit all. You need to know which diet is for you. First of all, starvation diet is not at all effective for long term, and for short term also I do not suggest, because acidity, gastric juice, person having this kind of issues, they are not just able to take this kind of diet. So starvation diet, like fasting for a long period of time, these are basically starvation diet, like the IF diet, fasting for 16 hours, then having the eating window is for 8 hours. These kind of diets we categorize as starvation diet. These are not at all effective, and in my view also not effective for short term, because people having some medical issues, they cannot take it. Next is, eggs are bad for your heart. Definitely not, because eggs are very good source of good fat. They have this choline thing which is also very good. So the egg yolk part, we restrict person to have to twice or thrice a week if the person is having any cardiac issues. Otherwise, eggs having highest biological value, approx 90, these are very good. But definitely you need to know how many eggs to have and how many eggs to have in a week maybe, and whether yolk part is also for you or not. Next is, sugar free automatically means healthy. No, absolutely no. Oh, there are many scientific journals on this, that artificial sweetness or sugar free, whatever it is, what name you give, these long term, if you consume that, they are linked to cancer and also many kind of disorders. They are low calorie or zero calorie, definitely, but the health hazards can't be you know taken aside. They have too many health hazards. So sugar free, if you buy a packet of sugar free biscuit, you may find that stevia or aspartame or some kind of sugar-free agent has been added to that. So once in a while you are having that, it is okay, but not on a regular basis. Next is, frozen foods are less nutritious than fresh ones. Uh, in like if you are in abroad, you will get access to frozen foods only. So you need to know which one is available to you. Definitely, fresh ones are good, but frozen ones, if you are not having the fresh one accessible, then you have to have the frozen ones. All vegan diets are healthy. No, that is not the case, because you need to know what kind of vegan diet is that. Is it limiting the dairy part? Is it limiting the fiber part? Is it limiting the protein part? So all vegan diets are not same. Some are restricting protein, some are restricting the fat part. So you need to know. Dairy is the only good source of calcium. No, no, no. Because you have roasted makhana, you can have sesame seeds, you can have spinach, green leafy vegetable, you will get calcium from there also. So if you are a person whom your doctor has suggested that you should go dairy free, then okay, for calcium, there are many sources. So dairy is not the only source. Next is, fat free foods help in losing weight. Yes, but I told you fat is essential to your body. So you need to know what kind of fat you are putting inside your body. Some fat is required, and preferably good fat. So completely banning the fat group from your diet, from your eating plate, that is not desirable. Next is, gluten-free diets are healthier. Gluten is a wheat protein. You find it in wheat. So some people are allergic to gluten, some people are having the celiac disease. In those cases, we advise, yes, go gluten free. But otherwise, if you're a healthy individual, you are not allergic to gluten, you are not having celiac disease, then why should you avoid gluten? So unnecessarily do not restrict lactose, gluten, or something like in markets you will be able to see lactose-free milk, gluten-free atta, low GI rice. So many options are there. But if you are not really your body is doing fine, then you should not restrict unnecessarily all these things. Next is drinking 8 glasses of water a day is a must. Yes, is a must, but there is a disclaimer. If your body requirement is high, like I told you, there's one patient of mine whose body requirement is 5 to 6 liters, then definitely you should have 5 to 6 liters of water. But definitely there is a minimum that is 8 glass that we suggest 6 to 8. That is a minimum thing. Protein bars are always healthy. No, because protein bars they add unnecessary sugar to that. They may add this thing no sugar protein bar, but again then in this workshop only I'll be discussing a part on this label packaging thing where you will be able to see that this gimmick thing, marketing gimmick thing, where they are writing no sugar but at the back they are adding some form of sugar to that. Last but not the least, skipping breakfast causes weight gain. So definitely breakfast is very much important, but if you are having a very light breakfast, that is also fine. Many a times people are having heavy breakfast because the person work schedule is such that proper lunch is not, he or she is not able to take. In that case, I suggest the person to go for a brunch, that is in between breakfast and lunch. A proper combo of breakfast and lunch is brunch. So no, skipping breakfast doesn't really makes you gain weight. As I was telling you, in the workshop, I'll be discussing a portion on packaging and labeling to so that you are able to, note the marketing gimmick. So the purpose, so the purpose would be to inform, protect, and attract the consumers. This is the packaging and labeling part. So to start with, when we see that we are buying any kind of items. So, to start with, packaging and labeling, what to look out for. So, when you are buying a packet or a can or maybe a bottle of anything, the first thing to look out for is the tagline or the name of the product, definitely, which you are buying, whether it is corn or peas or atta or chawal. Next is please, after seeing the MRP, definitely see the nutritional labeling part, the nutritional facts panel, where you will be able to see actually how much uh, fat, how much protein, how much total sugar and added sugar are being put in that packet. The packet may claim that it's a no sugar one or a low sugar one or a low GI thing and all that. But definitely to get the approval from the FDA or FSSI, whatever board they are, going for, the nutritional panel, facts panel is a very important and authentic, supposedly authentic part. So check that where you will be able to actually see whether they have done any kind of marketing gimmick or not. Next is the ingredient part. Definitely what all they have given in that part. If you are buying a instant mix, maybe a poha packet or a oats upma packet where you add water and it's all done. Often palm oil is added. Often certain preservatives are added. So check for them whether they are banned or not. Whether you will able to see, just you have your phone handy, right? When you go to a mall, so just check on that because often in India still we find some banned colors and banned preservatives are used. So better to go for 0.01% added preservative items or the fresh ones. Next is very important, the expiry date part. Often you will see in the mall discounts are being given or some offers like buy one get two, buy one get one offers are given to those products where the expiry date is coming very near. So you may think though, okay, I'll get buy one and I'll get two more. So you're buying that, but you are not seeing the expiry part. So after you are going back home, you're keeping it for another month because obviously you cannot consume three packets all together. So this is the marketing gimmick that they do. There from their part, it is all right because when they are selling, it is not an expired product. But the expiry date, if it's very near and they are selling it like this to clear their stock, you need to get yourself aware. Next is the allergen part and the additives or the preservative part. Suppose you are allergic to nuts or dairy, some kind of thing, or maybe gluten, as I was telling. So kindly read the labeling part where it is shown added nuts. Often it is written in red or green thing that it contains nuts or dairy. So that part you need to see. What are the red flag signs that you need to see before buying any product and definitely consuming that? Because ultimately it is going inside your body. You are using that, you are eating that. High sugar. Try to avoid all those HFCS like high fructose corn syrup, maltose, sucrose, all these types of things which are added as a preservative and also as a flavor enhancer. Say no to high salt, high trans fat, high saturated fat content items. So, how to read labels then? Check the serving size and the calorie part. If you are on a strict diet advice, or you know that yes, every day I consume almost 1500 calories, so you never know, one packet of a poha might give you 200 to 50 calories. So, always see the serving size and the calorie part before you are eating anything. Choose the nutrient part. Like if it says it is high on fiber, then check how much fiber it is giving, soluble or unsoluble, or added fiber, what is it actually? Vitamins, low sugar, salt, saturated fat, these are the things you should watch out for. What coming to the ingredients part, the first few items, most of the product. So avoid any hidden sugars and trans fats. So this you can see if you check, if you read the nutritional fact panel, as I told you, then you will see total sugar is this gram, and under that there will be added sugar 20 grams. So you can see that the sugar have been added separately as a preservative, as a flavor enhancer, whatever be it. Certifications, definitely look for FSSI, UGMark, organic marks, and other marks. So, because nowadays many new products are being launched in the market. Often we see that they are not being approved by any food board. So the certification matters a lot if you want to try new product. If you are buying a product which has been already into the market for quite a long period of time, then really you do not have to see the certification. But definitely in this era of duplication, you need to be aware of the well-known chain, of course. Last is the quick tip. Lesser than 5% DV is low, greater than 20% DV is high. So if it is written, the mark is shown as low, then check out for low, lesser than 5%. And if it is high for 20% DV, then it's high. This is a quick tip that you can check on the labeling part. Uh, Next is just watch the video once, then I'll be telling. So the child is having carbonated beverage, now lollipop, a sugar-based candy. Screen time is quite high, and the distance between the phone and the eye. He's having pizza, processed food now, full of fat. Now having cotton candy, a sugar-based item again. Now having another processed high salt item, French fries, fried as well. Again having a lollipop, candy, high on sugar. Juice, which is less on fiber, high on sugar. Again a sweet item, fat item, ice cream. Now comes the twist. Having fruits, which is full of natural sugar and fiber. Having pomegranate, which is a natural source of sugar, fiber, mental will take care of mental well-being. Green fruit, which has natural flavonoids, carotenoids, pumpkin, muskmelon, papaya, pineapple, yellow colored fruits. Having grapes, red colored fruits. Even these are sugar based, but natural. So when the child is having such kind of items, the mental well-being, the physical well-being is taken care of. And you can see the internal well-being is also being taken care of. So what are the healthy eating habits that you want to inculcate in at your home, especially to the kids and toddlers? First thing, help them to choose their food wisely. Ask them, give them a plate full of fruits, vegetables, and many options, but healthy options. Then you ask your daughter, your son, or whoever is present to choose. So the choice is only made with healthy foods. He or she has no option to choose a junk food. So he or she will learn that I am given this food only. So these are healthy food. At school also, many schools have taken this initiative of inculcating healthy food and unhealthy food. In tiffins, they check whether the child is bringing a healthy food or an unhealthy food. I have seen myself, it is a case of 2.5 to 3 years old case, 3-year-old child's case, where I have seen the girl is bringing a packet full of biscuit because she left her tiffin box in the school, and the school authority, like one parent shared that photo of the tiffin box in the group to tell that somebody has, misplaced her daughter's tiffin box. So she shared the photo in the group, and I saw that tiffin box is having 15, approximately that a packet holds 15 pieces of biscuit. And mind you, the age of the child was 2.5 to 3 years old. So whoever has done it, be the mother, but the father or caregiver or the grandparent, whoever has, bothered to give the child this packet of biscuit in her tiffin. And that is all, the tiffin break was around 9:30 to 10. So practically it was the first thing that she was having. It is very difficult. It is very easy to become a father or a mother to a child. But in this era of infertility, it is very difficult to become a parent to a child. I believe this because, as I told you, in this era of infertility, you will become a mother or a father to a child. But if you have to be a parent, you have to look for the well being, not physically, like your child is doing well academically. No, you have to take care the well-being in terms of her health or his or her health also. So if you are giving something in their tiffin like chips or namkeen or chocolates or a packet of biscuits, what you are doing to your child will choose food accordingly, na? So give, teach your daughters, teach your sons that this is not the correct way of eating food. So eat at regular times. Definitely, you should have a pattern: breakfast during this time, lunch during this time, dinner during this time. There should be a discipline of eating pattern. Second is the portion control, how much you are giving. Too much you are giving to your force feeding your child. This is not good. You should know that frequent meal works for your child, or wholesome one at a time works for your child. Include all food groups that I've discussed, like carbohydrates, protein, fats, vitamins, minerals, water, fiber. All the groups daily. It's not like today I have given too much of protein. Okay, tomorrow I won't be giving too much of protein. Tomorrow I'll be giving too much of fat. It is not like that. It is not mathematics, or it is not what to say. You cannot balance it like that. Next is definitely limit, restrict, monitor processed or junk food. Stay hydrated, and mindful eating, which means avoiding screen time while eating. Talk to the child while eating. Talk to the child about the food that he or she is having. Then she or he will have interest in the food she or she is having. Play with the child while sitting only. Talk to the child. What did you do in your school? But do not allow the child to see TV, television, or phone while eating. Let them enjoy the food. That's the main thing. Otherwise, your child will always run away from the food. Portion sizes, variety, and meal planning. It plays a very important role. Often we see some parents are giving too much of food in a child's plate because he or she is thinking that my child will eat all these things and he or she will become a very healthy individual. It's not like that. He or she might become obese. So you need to have small plates for portion control. Include multiple colors for varied nutrients. Like I was telling you the in that video, the child was having green fruit, orange fruit, purple fruit, red fruit. So try to include multiple fruits. I'm not asking you to include green avocado or pink dragon fruit. All those are seasonal, local, yet colorful. Go for that only. Sample days menu. When we go to the restaurant, we ask for a menu card. Give us a menu card, I'll choose. Why don't we do it at home? I'm not putting you in a bad situation where you are going to ask your wife, give me the menu card, prepare today's dinner. But what you can do is you can do a cyclic menu that many hostel or mess do. So that you can beforehand do the preparation. Otherwise, you will think, today what should I prepare? Okay, let's order from restaurant. If you don't give yourself that prep time, then obviously you end up ordering outside. So do a cyclic menu. Monday breakfast is this, lunch is this, dinner is this. Tuesday the three meals should be like this. Wednesday, three meals should be like this. Like that, you have a whole month menu like this only. You do not have to use your brain too much of stress into that. Tomorrow, what should I bring for the dinner? Tomorrow, what should I prepare for the lunch and all? But definitely, beforehand preparation matters a lot. Next is core principles and mindful eating. So eating on time is a very important thing. Today you are having your breakfast at 7 a.m., but tomorrow at 9 a.m. Of course, 7 a.m. can be 6:45, can be 7:15, 7:30, but 2 hours difference makes a huge lot of difference to your health, to your body as well, because your body is used to having breakfast at 7 or 7:30. For quite a long period of time, your body is not getting that fuel at the right time. So it will start deteriorating, the functioning ability will go down. Always go for seasonal and local foods that I was telling in the previous slide. You do not have to buy the fancy ones to, be updated on the nutrition part. Yes, yes, I am a healthy individual. I am having a good nutrition because I am having avocado, dragon fruit, kiwi, and what all. No, you do not have to have all that. If you're staying abroad where these are very easily available, yes, obviously, you will not get guava easily there. You will not get many fruits which you get here. So what you get here, have that. What you get there, have there. Avoid distractions while eating. That is no screen time. Otherwise, whatever you are eating, you are not able to taste that. You are not able to differentiate. Okay, this is I'm having bhindi. Bhindi has seeds. It tastes like that. Tomorrow you are having parval curry. So what is the difference between bhindi and parval curry? That is how you start developing boredom towards food. All taste same, but your wife has prepared it, suppose, in a different way. But you are busy with the screen, so you are not being able to differentiate between a bhindi curry or a parval curry. So try to enjoy food while you are eating. Last is eat slow so that you can chew well, so that the digestion can go simultaneously, and stop when you are 70 to 80% full, not totally full. Because this is a technique we apply everywhere. Like even when we are filling a bucket full of water, what we do? Keeping 1/4 inches of our finger empty, we stop the tap, right? So that we can carry, so that the water doesn't fall off from the bucket. Same with our health only, na? Same with our body only. 80%, 70% should be full, 20-30% should be empty, so that they get enough. We don't over feed ourselves. Next, coming to the most important part of this workshop, the medical issues part. Many of the people out India or outside India in this whole universe, human beings, I'm telling, they suffer from a various lot of medical disorders. To start with, diabetes. What is diabetes? We all know diabetes and obesity, right? Diabetes is a elevated blood sugar level. Obesity is weight gain abnormally. So if these two happen together, we refer to the term diabetes. So it is basically a combination of obesity and type 2 DM, which is caused by poor lifestyle choices and genetic also predisposition. So the causes are, if you are having too much of food, too much of calorie, then you are gaining weight, you are becoming overweight and eventually obese. You are also having a sedentary lifestyle. You are not doing any kind of physical activity, you are not hitting the gym and all that. So insulin resistance will get affected. And if you have a family history of diabetes also, then also likely you will have this diabetes. So all the symptoms will pile up and you will develop this issue diabetes. Symptoms can be jotted down as unexplained weight gain. You do not know how you are gaining weight, but actually you are gaining weight. Frequent urination is a common symptom of diabetes, along with increased thirst and hunger, fatigue and blurred vision, and also difficulty in losing weight despite diet attempts and now you start physically active and all that. Still, you are finding difficulty in losing weight. So here is a slide where the summary of all the factors linking to diabetes has been jotted down. Next, what you can do to it, what can be the nutritional and lifestyle approach? The diet tips can be such that choose whole grains over refined ones, like go for oats, millets, brown rice, jowar, bajra, ragi. Go for lean protein, skinless chicken. Avoid the skin part. Healthy fats. Choose, as I told you, fats are not bad because in lipid profile report also you will see HDL, which is a good cholesterol. So healthy fats like the pufa mufa. Reduce your sugar intake, be it refined, be it in the form of sweets, whatever be it. Refined carbohydrates in the form of maida, corn starch, corn flour, and also the frozen food, processed food, preserved food, fried food. Uh, Increase your fiber part in your diet. From the lifestyle part, definitely 150 minutes per week, that is approximately 30 to 45 minutes per day. You should do any kind of brisk walk or any kind of physical activity. It can be yoga, it can be indoor exercise, non-instrumental, it can be HIIT, whatever form of. Weight loss of 5 to 10% improves insulin sensitivity. Once you start losing weight, you will see the improvement in your insulin sensitivity part. Monitor, we say SMBG, like self monitoring of blood glucose level. So you have to monitor your blood sugar level. If not regularly, then maybe bi-weekly using the glucometer. Avoid any kind of sugar beverages, fried foods, and excessive alcohol also. So I have seen this kind of patients coming to me and saying, I do not take sugar, not even in my tea, not even sweets and all. So if I'm not having sugar, if there is no sugar in my diet, then why have I developed this diabetes? No, nowhere it is written that if you consume sugar, then only you have this sugar related disease. Blood sugar and this refined sugar, these are not same, right? So how can it be that you are not taking refined sugar or any form of sugar and the blood sugar level will be not elevated? So watch out on that. Next is the hypertension part. Hypertension is what? When your blood pressure level goes up. How much? What the level is 120 by 80 plus minus 10. This is the normal level. So it can be 130 by 90 or it can be 110 by 60. This is also normal. That is why I say 120 by 80. So what are the causes of elevated blood pressure? If you take excess salt or raw salt in your diet, you might have a likely chance of, getting hypertension. If you are an obese person with high levels of work pressure, stress, anxiety, and your lifestyle is also very much sedentary, you do not do any kind of physical activity, and your history is also, have your mother, your father have this HDN, history, then likely you can have this disorder. The symptom is often silent, but it may include headaches, symptoms like headaches, gasping, that is shortness of breath, and dizziness. So the hypertension disorder can affect your whole body in the form of heart disease, cardiovascular disease, bone loss, loss of vision, which is extreme in extreme case, stroke, and also kidney disease. So these are the complications. What can be the nutritional or diet perspective to, curb down hypertension? You should follow a DASH diet. DASH diet is dietary approach to stop hypertension diet. So your diet should be high in fruits, vegetables, and whole grains. That is basically fiber. Low in fat, that is low fat dairy, lean meats, and reduce your sodium content to lesser than 1500 mg per day. In markets, there are low light salt, so you can go for that. Pink salt, you can have a combination of that. Lifestyle, coming to the lifestyle perspective, you should always maintain a healthy weight, healthy BMR. You should do regular physical activity of 35 to 40 minutes. You should limit your alcohol intake, quit smoking, and definitely well hydrated. The right diagram is showing the healthy zone of 180 by 80 diastolic and systolic pressure. Elevated zone would be greater than 120, lesser than 80. So, like that, you can see stage 1, stage 2, hypertension, and ultimately hypertension crisis level. Next is the dyslipidemia part. What is this dyslipidemia? Means mal, which is not right. This word refers to that. And lipidemia is lipid. So if you have an impaired lipid profile, your cholesterol level, your triglyceride, HDL, LDL, VLDL, all these parameters are going up and down, then it is a case of sure dyslipidemia, where your high cholesterol or triglyceride, low HDL is going way above or below. So, what are the causes? Your diet probably is high in trans fat or saturated fat in the form of fried food you're consuming, maybe processed, maybe preserved food. You have a genetic history of having this kind of disorder. Diabetes is also one such cause for which you can develop this kind of disorder, where you can see this atherosclerosis is a condition where the fat layer gets deposited in the form of, you can see in this slide, the capillary tube. The cholesterol is getting accumulated, deposited in the blood vessels and blocking the normal blood circulation. Symptoms often asymptomatic, but definitely there can be causes of cases of chest pain, xanthomas, that is fat deposits under skin, atherosclerosis. So the complications can be stroke, heart attack, and so on. What can be the diet approach? You should increase on the omega-3 fatty acid part. You can take a capsule. You obviously, if you are not able to take fish and flaxseed due to your work schedule or whatever be the reason, but still I would ask you to take the fresh ones, like from the diet itself, fatty fish, or for the vegetarians, it is flax seeds. Eat soluble fiber in the form of oats, legumes to lower down your bad cholesterol. Avoid saturated fat, trans fat, processed, preserved, frozen, fried foods. And from the lifestyle perspective, do aerobic physical exercise, maintain your ideal weight, quit smoking and alcohol, and go for regular checkups. Like if you have an impaired lipid profile, the checkups should be done in an interval of 3 to 6 months. And if you're a healthy individual, you should do your lipid profile checked within a span of 6 to 12 months. Next is the fatty liver part. Now, people who have this weight gain issue, obesity issue, they are mostly predisposed to this condition where a, a thick layer of fat is being deposited, is covering the liver. So there are two types: alcoholic fatty liver disease and non-alcoholic. I'll be talking on the NAFLD part only, non-alcoholic part, where you're not consuming alcohol much, but still you have, gain weight, and you are detected with hepatomegaly, with fatty changes thing, which is another term for non-alcoholic fatty liver disease. So the causes is obesity. If you're consuming too much of fat, alcohol, sugar part, if your insulin resistance is not right, then so the symptoms can be you are having fatigue, you're having some pain in the abdominal part, and if you are doing a ultrasonography, definitely you'll be detected with this hepatomegaly with fatty changes grade 1 or 2 or 3. Complication is liver inflammation, cirrhosis, and liver cancer in extreme cases. So the diet tips would be to reduce, to cut down your refined sugar and fructose part, eat whole grains, lean protein, unsaturated fats like PUFA and MOFA. Increase on your antioxidant part. Go for fresh, colored, flavonoids rich fruits and vegetables. From the lifestyle approach, go for regular exercise to improve the liver fat metabolism, maintain your healthy weight zone, and definitely avoid alcohol in such conditions. So, medical follow up would be go for regular liver function test, and also within a gap of 3 months, go for whole abdomen USG ultrasonography. So these are the stages of liver damage, as you can see, from healthy liver, the fatty liver, fibrosis of liver, liver cirrhosis, and ultimately liver cancer. Next is the nutrition for gut spine axis. So we know what is gut. Probiotic, prebiotic is very good for gut immunity and all. But how does it link with the spine, spinal cord, spine axis, which links to the brain? Yes, it has got a direct positive connection. When your gut is fine, when your gut is good, then your brain is functioning well. This is the main connection. So, connection between the gut microbiome health and spinal or the brain function via immune and inflammatory pathways. So the causes of disruption can be if you're having an imbalanced diet, poor diet that is low on fiber, low on antioxidant, low on omega-3 fatty acid, and definitely low on prebiotic, probiotic bacteria, then the fiber part is also getting compromised, and your body is inflamed somehow. You are having too much of stress in your lifestyle and a very low physically active lifestyle, then you may have this kind of issue. And the symptom can be various kind of digestive issue like bloating, acidity, gas, back pain, fatigue, and also brain fogginess. The diet tips can be like include prebiotics and probiotics like kombucha, yogurt, kefir, and the prebiotic part. Try to include fiber part like from the onions, garlic, bananas part. Go on anti-inflammatory foods to lower your body inflammation by including turmeric, ginger, green tea, and definitely, well, hydration is the main key. From the lifestyle part, maintain your spinal posture. Don't droop down when you are sitting or standing. Try to have a upright position, even if you are having work which involves sitting for quite a long time. Now, various pillows are also available on the market. Whatever is suiting you, try keep your spinal posture right. Utilize that. Regular stretching and core exercises would help you to manage this thing, and also try to lead a stress less less stress life with mindfulness and meditation, whatever suits you, as I say. What are the common disorders or mistakes in kids and toddlers' health? I think this is a very catchy thing for the mothers if they are listening, any mothers out there. So, the disorders you will find undernutrition to be the maximum, constipation, weight management, like it can be underweight or it can be overweight issue, and also some iron deficiency anemia. The mistakes are too much of outside food in the form of processed, preserved, fried, packaged items, skipping breakfast. My daughter or my son is like very much inclined to junk food. She often skips breakfast and wakes up and then hurries to the school. No, you have to develop a routine. You have to make your child understand. Maybe some soaked nuts with some milk, whatever is fine with him. Talk to him. Maybe a sattu water, whatever is going to fill for 2 3 hours before the actual tiffin break starts. Lack of fruits and vegetables and also whole grains in his or her diet. Too much of screen time and also less activity under the sun. The solution would be go for balanced meals, family meal time, so that screen time goes less, and limit sugar and salt. So, child nutrition common disorders to highlight iron deficiency, anemia, constipation, and obesity from junk food. Mistakes that parents make. Yes, they predispose the child. They expose the child to too many of packaged snacks. Okay, today is Friday. Let's go to the mall. Let's go for a movie. Okay, let's buy a packet of popcorn, let's buy a packet of nachos. Yes, definitely they also need this, but do not expose them too much of that. Yes, okay, once a month we'll be going out having some kind of food outside, but that is it. You are also allowing your daughter or son to have this kind of food, but limiting it to once a month or twice a month. Skipping breakfast. Oh, he or she is not ready to have breakfast and also saving time on me. Go to school without any breakfast. No, do not do that. Excess screen time and low activity under the sun. Often I get to hear from the parent that my child is a picky eater. 51% of the parents complain that. Normally, childs are picky eater. There is a phase that we say picky eater phase. That is when the child has turned 2 years. That phase we refer to a picky eater stage. That time, if you do not pay any attention, then your picky eater toddler will go up to a picky eater adolescent, and you can do not you won't be able to do anything to that. So try to make use of the time. Child doesn't like healthy food. 27% mothers complain that, because maybe you do not make that nutritious. You just give boiled vegetables to that toddler, so that is why he is not finding anything. So if you're making a pasta, try to make a home cooked pasta sauce, red sauce, by making use of tomatoes. So by this you can make a red sauce. So do not take help from outside to make any food tasty. You can do it home cooked way only. Cost of healthy food is 32%. No, no, absolutely not. If you buy the fancy one, yes, then it is going to make you drain. But if you are going for seasonal local food, then it won't cost you. It will the cost food cost will go down only. Lastly, no time to prepare healthy food. Many mothers, many parents, many caregivers complain. So it is because you do not plan. You get up and then you start thinking, what should I give in the tiffin? What should I prepare for my husband's tiffin? Why you should do that? I told you should make a cyclic menu, then it is saving your time or preparation time. So if you are waking up and then thinking, then yes, it is going to take a toll on your health also. So prepare beforehand. If you're making something like vegetable oats chilla, you parboil the vegetables before the night before, so the vegetables are already boiled, are already cooked, so you do not have to waste your time on cooking the vegetables. So you can do this small kind of preparation day before, night before only. Building healthy habits early. As I told you, if you cannot train your toddler at the age of 2 3 years, you have to deal with a picky eater adolescent. So try to involve kids in cooking, making meals fun with shapes and colors, and encourage outdoor play, that is under the sun, as I was telling you. So the summary would be: eat balanced meals in a family. Not you are eating a balanced meal but you are not giving your daughter or son a balanced meal. So as a family, try to eat balanced meal. Read food labels, avoid myths, follow signs, and be consistent in healthy habits. Okay, for 20 days I'm in a diet, I'm following healthy advice, healthy diet, and all. But the remaining 10 days, I am having alcohol, going to parties, and your daughter or son is also seeing that. You are your daughter or son's idol, so you should not follow a path which is not healthy. So, to end the slide, to end this workshop, eating healthy is not just a diet, it is a lifestyle. So, I believe in this very much because, as I say, 20 days I'm following and the rest 10 days I'm not. So, that is not a lifestyle. You're just following a diet advice given by your nutritionist or dietitian or whoever it is. But if it is in your lifestyle, you should have followed that 365 days a year only. Thank you so much.